Hello, everyone. I'm Dr. Marty Ross, and tonight is another Conversations with Marty Ross MD. We're going to talk about Lyme disease here tonight and see what we can learn and see if we can find some answers that help you to improve your health. For those of you that are coming back again, it's good to see a lot of familiar names on my message board, and I'm glad to see you keep getting some value and you keep coming back. For those of you that are new, welcome. This is a forum where we get to talk about Lyme disease, and you create it with your questions. So the way that you can participate, there's two ways. Number one, you can listen to the questions as I read them out loud. People write them to me, and then I read them. If you're in the live version, they actually show up in the bottom of your screen as well, too, so you can read along. And you can just see what the responses are to that. The other way you can participate is to actually try to write a question to me. The reason I said try is I usually can get through a majority of the questions, but I don't get through all of them each week. So just realize that I try. But there's usually a lot of questions. But write a question to me, and you may get your an answer to your question as well too. During the webinar tonight, as usual, I am creating a recording, and my intention, if everything goes well, is that I get that edited up and create a synopsis of it, and then get that out to you tomorrow morning, usually by around no later than 9:30 a.m. Seattle time. That's my intention. We'll see how that goes. And sometimes YouTube doesn't cooperate with me where I load it up. And sometimes my editing software doesn't cooperate, but generally it works out well. Tonight is our first webinar of the month. And then we have another one next week, and we have one the week after that. I may take the one and 2 Thursdays from now, make it a Wednesday one, but right now it's listed as a Thursday one. So feel free to sign up for those and see what we can do. Tomorrow morning, when you get the email from me, I'd appreciate it if you would share that email with any person you think might benefit. When you send that information out, you're helping their Lyme disease, and you're also helping me reach more people in my quest to help as many people as possible with this illness. All right. So without any further ado, let's go ahead and get started. So again, if you're in the live version, you should be able to see the question post on your screen, okay? So the first question is from Dave. Hi, Dave. Let's see. Hello, Dr. Ross. Are binders the only way to get rid of mold toxicity, or are there better alternatives? Also, you have previously mentioned that for a small percentage of people, you become a self-producing mold factory. At which point, at which point there are prescription fungal medications that would be the next step into getting rid of the mold if binders don't work. Question, why wouldn't we just go straight into treating as if you were a self-producing mold factory instead of first using binders to see if they will help? Are those fungal medications tough to handle and come with harsh side effects? Or are they used as a last option instead of first starting option? Thank you. All right. So I'm going to answer your question, but I want to give everyone the same background here. So there is a condition called mold toxicity, which happens in about 25% of all people, regardless of whether they have Lyme or don't have Lyme. Anyone, 25% of us have a chance that we're going to get mold toxicity. And what happens in that condition is there's a genetic programming error that makes it so that we don't get rid of them. What happens in 75% of people, and these are people without the programming error, is we breathe in a mold toxin, it gets into our bloodstream, and then some of our white blood cells will tag those mold toxins, and then seeing these tag toxins, other white blood cells will come in and break them down. Okay, that's what's supposed to happen. In 25% of people, they don't get tagged, and so they don't get broken down. They go to the liver. The liver can't handle them. The liver is supposed to try to transform them into a water-soluble toxin, but the liver is not able to do that. And so they're moved by the liver through the gallbladder and the bile system out into the intestines, still as a fat-based mold toxin, and they get reabsorbed back into your bloodstream. The trouble with these mold toxins is they are not handled well by the immune system, as I said. And the immune system, in response to seeing these mold toxins, overproduces inflammation chemicals called cytokines. Keep in mind, when you have Lyme, the main reason you feel bad is your immune system is making too many cytokines. And when you have too many yeast in your intestines, the main reason you feel bad is your immune system is making too many cytokines, okay? So excess cytokines give you brain fog, make it so you can't sleep, give you body pain, interfere with how your hormonal systems work, give you severe fatigue, et cetera, Okay. All right. So they all look the same, basically. So mold, yeast, tick-borne infections all look the same. All right. So one of the issues with mold toxicity, or the main issue, is that you get these mold toxins in you. Okay. And the way to get them out is to try to grab hold of them out in the intestines using what are known as binders. All right. And there's a variety of binders. You can use herbal binders. And so some herbal options are activated charcoal, silica, humic acid, bentonite clay, zeolite clay. Some products have them all together. So for instance, GI Detox and a product by Research Nutritionals called Mycotoxin, both use clay, silica, humic acid, and activated charcoal. Okay. Or you can get individual activated charcoal, for instance. Another general binder to use is pectin, and pectin powder can be a good binder as well too. So to answer the first part of your question, there is no alternative to binding the mold toxins. You got to pull them out. And to do that, you grab hold of them in the intestines. Okay. Now, there is one small alternative you can consider, but it's only to get a part of the problem. And that is if we sweat, if we heat ourselves up to sweat, we can either do that with exercise, which I know in these illnesses is hard to do, or we can do it with infrared saunas. We can do it with hot baths, hot showers. Whenever we sweat, that is one way to detox, okay? But it's not the best way. What happens when you heat up and you're sweating is that all that heat pulls toxins out of your body and moves it into the bloodstream, okay? And then from there, about 20% of the toxins get sweated out. The other 80% still need to go to the intestines or through the liver to the intestines, all right? And so you still need to bind them up in the intestines. But in somebody that really cannot tolerate binders at all, I might have them just try to sweat them out. But I got to tell you, it's a long process and will not go as well as if you can use binders, all right? All right, so then there is a percentage of people, a small percentage of people that when they have been in these mold environments, sometimes people might breathe in mold spores, and then they start having microscopic amounts of mold growing in their sinus passages and in their intestinal tract. And those molds that are living there start producing toxins. So you become your own mold toxin brew pub, if you will. Okay. And so for those situations, that's when we wind up having to give you something to kill the mold spores in your nose passages and in the intestines. All right. Now, different doctors have different ways to handle this. I know there are some doctors, knowing that there is the possibility of having mold spores producing the toxins, will start you on binders and start you on mold germ killers at the same time. Okay. There are doctors that do that. I don't do it though, because my experience says about 70%, 75% of the time, the only problem people with mold toxicity has is that they have them trapped in their bloodstream from previous exposures, and that there is no reason that we need to use to actually kill the mold spores, okay? Because in my opinion, and what I see in my practice, now every practitioner is different, who they attract in their practice is different. It's only about 30% of people do I ever need to resort to using mold killers. In other words, within 6 months, 70% of the people in my practice get better just using binders, and we never have to worry about are they producing their own. Okay, all right. Now, why would you not want to put something on something somebody on something they don't need? Number one, they don't need it. Number two, there's always the risk of any medication we use of side effects and liver injury and kidney injury, et cetera. Okay, these mold killers generally all have a potential of liver inflammation. That doesn't mean it happens, but they all have that potential. So even though I work with a lot of things in my practice, I tend to be very rational in terms of not throwing the whole kitchen at somebody. I try to find the key things we need to do to get them well. And so my own philosophy is to go more minimal, but with the things that we necessarily do need. That's just my philosophy. And I'm doing that so that I don't harm a person with medicines that they might not need, basically. Okay? All right. Good luck to you, Dave. So for those of you that are new to this idea of mold toxicity, which there may be somebody that's new to it here, I'm going to go ahead and do a screen share here. I think I'm going to do a screen share here. Let's see. Hold on. Oh. Well, that's not working. Hold on here a minute. What happened? Let's see. Get out of here. All right. I thought I had it set up so I can show you these, but I have to set up again. Hold on here just a minute. Okay, so I'm going to try to do the screen share again here. Let's see. There we go. It's going to work now. Okay, so this is my information website, my Lyme education website, Treat Lyme by Marty Ross MD. In terms of where you can find information about anything, if you're looking for information, type in what your question is right up here in the search bar. If you want to know about mold toxicity, just type in mold toxicity. Okay, so that's one option for you. Or take a look in my online Lyme guide and see the various topics that I have here. And so this mold toxicity would be found under detoxification. And then take a look at my article here called Mold and Lyme Toxin Illness. Okay. All right. All right. Let's see here. Hello, S. Good evening. Let's see. My uncle just went through COVID, then got a blood test. His white blood cell count was slightly low, and his urine albumin creatinine was 183. It says it's microalbuminuria if between 30 and 300. Let's see. Yep. Have you seen this in your COVID patients? What insights do you have into microalbuminuria? His doctor said nothing so far. Thank you so much. So microalbuminuria basically so albumin is a protein, all right? And your kidneys are not supposed to release it. They're supposed to filter it, but keep it in the body. And if their filtering membranes have become injured, they might start releasing small amounts of it into the urine. So it's a sign of microscopic tissue kidney injury, basically, okay? Where we tend to see this most often is in diabetes. And in fact, we screen people with diabetes, do urine testing to make sure they're not having microalbuminuria. And if they are having it, we start putting them on certain medications that are high blood pressure medicines, the ACE inhibitors, specifically things like lisinopril, for instance. We put them on low doses of those to try to protect the kidneys from further injury, basically. I have not seen this occur in COVID. I would think it could occur in COVID. I mean, COVID is a body-wide infection. I don't know from studies whether actually putting people on ACE inhibitors helps this condition or not in somebody with COVID, all right? So I'm not sure the best way to go with it, to be honest with you. Probably if this was my patient, I would probably just observe and look at them again, maybe in 3 months or so, retest again and see what's happening. Clearly in diabetes, we know using these ACE inhibitors can make a difference. But again, I don't know whether they make a difference in this condition or not. Okay. All right. Good luck to you guys. Good luck to your uncle. Hello, Brandy. Let's see. Do you have any pain and discomfort remedy suggestions for a hiatal hernia? Thanks. So, a hiatal hernia is basically means that part of your stomach slides up through an opening in your diaphragm, entering up into the chest area, basically. And so where your food pipe comes from your mouth and meets the stomach, okay? where that meeting is, the food pipe is above your muscle called the diaphragm, and your stomach is below the diaphragm. All right. So if part of this starts sliding through the opening in the diaphragm up, you wind up getting acid up here, and that diaphragm, its purpose. So one of the things the diaphragm does is the muscle that causes your lungs to expand and get smaller. Okay, but the opening through which your food pipe passes, the opening, all right, your food pipe passes through that opening. This opening squeezes on the place where the stomach and the food pipe meet to help keep food and acid down in the stomach. So it's a part of the closing mechanism that keeps the stomach closed, so your acid and food content don't get up into the food pipe, in a sense. Okay. So now if you've got part of the stomach that has slid through, you don't have as good of a valve that separates the food pipe from the stomach. You wind up getting acid that can go up into the food pipe then, and you wind up getting symptoms of heartburn. All right. So one of the things I'd like to do for heartburn is to help limit the injury and the sensation of the acid irritating the food pipe. And one of the ways to do that is with deglycerated licorice. So it's licorice that is an herbal remedy that has a chemical group called the glycyrrhiza group removed. The glycyrrhiza group can lead to high blood pressure. All right, so it's deglycerated licorice, and you chew a couple tablets before meals, 3 times a day and before bed. What happens when you chew licorice, your spit and saliva mix in with it, and together they create a microscopic gelatinous coat that coats the food pipe and that part of the stomach that goes through and keeps it from being irritated, basically. All right, so that's one solution. Aloe vera juice, 1 to 2 ounces, or gel, food grade gel, 1 to 2 ounces before meals a few times a day can make a difference on that as well too. Ultimately, if it is a severe problem, sometimes it has to be surgically repaired. There are some osteopathic physicians that do a process called visceral manipulation, where they can try to use their hands on the stomach and the chest to try to change the dynamics so that the stomach stays down and doesn't come up through that opening as well too. That's another option too. Okay. All right. Thanks for your question. Hello, Mosby. Let's see. What are the symptoms of potential fungal infection deep within the sinuses? And are there any treatments you recommend? I can't tell if that is where the infection is or if it's just toxin overload that manifests to the skin around all the face and lymph nodes. So let me make a distinction. So earlier tonight, I talked about colonization with mold, which is different than having a full-on infection. Colonization means you've got small amounts of it and they're still releasing toxins. But if you have a fungal infection deep, often what will happen is you'll have a lot of pain and pressure in the sinus areas. You don't always get that when you have the colonization of mold, okay? But if you have full-on infection, you'll have pain, pressure, might have a lot of watery nose, for instance. And also you could get a CAT scan. That's usually how we'll figure it out, is get a CAT scan, and you can look in the sinuses and see the levels of the infection in a sense too, okay? Let me see if I got the question answered here. See, what are the symptoms of potential fungal infection, and are there any treatments you recommend? So, what I would do in that kind of situation is actually confirm you have the diagnosis. And so not for colonization, but for full-on infection, get a sinus CAT scan. With the CAT scan, they'll be able to tell by the way that whether the sinuses are opacified or they look white on a CAT scan. That can tell you whether you have infection in there or not, okay? All right. Good luck to you, Mosby. Hello, Tim. Let's see. Hi, Dr. Ross. How are you doing? I'm doing well, thanks. A little tired tonight. My tubus singes decided they were going to have multiple episodes of diarrhea in the middle of the night. So I kept my evening interesting. But beyond that, I'm doing well. Thank you. Let's see. I have been treating for yeast and had a huge die-off reaction, after which I felt so much better. I'm so happy. I know I have to keep treating for a while longer because it's only been 5 days. However, I'm curious how fast it could grow back. Let's say if I take a 1 day break in treatment, has all of it grown back the next day? Thank you so much. Intestinal yeast, with intestinal yeast, you can take a day or two break here or there and you're not going to go backwards. That compares with like a Bartonella or Babesia, where you can get pretty rapid declines. That hasn't been what I see happen with intestinal yeast overgrowth. And I'm glad to hear that it is making a difference for you. Okay. So everyone, too many yeast in the intestines can lead to a lot of things. So people with too many yeast often will have a lot of sugar cravings. They may feel a lot worse if they happen to have simple sugars or carbs. They'll have a lot of intestinal gasiness or bloating. They might even get a lot of pimples or acne or skin changes. And that's because when you have too many yeast in the intestines, they release toxins that get into the bloodstream and can interact with the skin, leading to skin manifestations of yeast in the intestines. Not that on your skin is there yeast on the skin, but rather you get rashes that are coming about from the toxins that get up to the skin, basically. Okay, all right. The other thing that happens if you have too many yeast in the intestines is they trigger cytokine excess. And so it'll make all of your Lyme, Bartonella, Babesia, et cetera, symptoms look a lot worse. And so I'm always screening every one of my visits with the patients. I'm screening to make sure that they don't have too many yeast at the same time. I usually go through a set of questions. I ask them, are you having sugar cravings? Are you having gasiness and bloating? If you're a woman, do you have any vaginal itching, vaginal discharge? Do you feel like things are getting caught in your food pipe as you swallow? And do you have any skin changes? And I use that as a screening because I always want to make sure I'm not causing them to get too many yeast in their intestines. All right. Thanks for that question, Tim. Good luck to you. Hello, Patsy. Hi, Dr. Ross. What can be done to reverse muscle wasting in those who are being treated with antibiotics and have Lyme, Babesia, and Bartonella? Thank you so much for having these webinars. All right. So muscle wasting in chronic Lyme has one big problem, one cause, and also another cause. The two major causes are, number one, these excess cytokines that I've told you about that give you most of your Lyme symptoms can cause a muscle wasting. Okay, just that. Okay. The second thing that can lead to muscle wasting is not as much activity as what you used to do before you got sick. So using muscles helps beef them up, if you will. And so if you could have muscle wasting from just not having enough activity or inactivity, basically. Okay. All right. The one thing you want to do is you want to treat your infections, because ultimately treating the infection is going to get the cytokines to come down. Okay. But in addition, you want to take cytokine lowering supplements. And so my favorite is to use curcumin. And it's a 500 milligram pill. It's made by Thorne. A product is called Bariva 500. That's what I like using in my practice. I guess Thorne is changing the name of that product to something called Curcumin Phytosome. It's the same product, they're just giving it a different name. But it's 500 milligrams 3 times a day. You might even try 1,000 milligrams 3 times a day. The other thing you can do to lower those cytokines is to be on glutathione. And I like using for that a product by Research Nutritionals named Trifortify. It is a liposomal variety of glutathione. Liposomal means it's microscopically wrapped in fat to increase its absorption. And you need that with glutathione. You need something to help get it absorbed into the bloodstream. And so the liposomal way is to do that. And Research Nutritionals has got some great research showing that you really do get good absorption into your bloodstream and into your red blood cells when you take their product. And for that, I would do 1 teaspoon once or twice a day. Okay. in terms of the inactivity as you can increase your activity. And my rule for activity with patients is at the beginning, a person may not be able to do it. It just may make them too much worse. But try to find a level of activity through trial and error that doesn't make you worse the next day, and keep doing it. That could be walking, could be light weightlifting, could be a whole host of things, okay? But the key is to do a level that doesn't wipe you out the next day, okay? All right. Thanks for your question. Hello, Matthias. Let's see, I'm going on a trip to Brazil, and it's recommended to take the yellow fever vaccine. Since this is a live viral vaccine, I wonder if it's a good idea to take it when dealing with Lyme disease. So this is one I don't know. I actually don't. I would look into it a little bit more. I think I'm going to have to just leave it at that. I honestly don't know the answer to this. I mean, honestly, when you're weighing out any vaccine, you're weighing out risk and benefits, okay? So you're weighing out preventing the risk of getting yellow fever, which can be devastating. And if you are a person with Lyme disease who happens to have immune suppression, not just against Lyme, but against other germs, then maybe it's not a good idea, but I don't know. I honestly don't know. So keep in mind, when we say that somebody with Lyme has immune suppression, because we all think, everyone with Lyme thinks they have immune suppression. Well, the truth is you may have some immune suppression for your immune system's ability to fight the Lyme germ. That doesn't mean everyone has universal immune suppression against all infections, okay? So, for instance, there are some patients that during viral season pick up every virus that comes along. Those are people that have general immune suppression, all right? But my experience is that generally most of my patients with Lyme during regular viral season, not during COVID viral season, but during regular viral season, that there's a group of people that don't pick up things any more than anyone else does, basically. All right. So I would have to look into that a little bit more. All right. Good luck to you, Matthias. Hello, TJ. Let's see, when I sit and lie still, I feel like my whole spine is buzzing or vibrating. Any ideas what could be causing that? And do you know what the symptoms are for encephalitis and meningitis? Okay. So in my experience, so vibrating and buzzing is it means your nervous system is agitated. Right? And the condition I tend to see that does that is Bartonella. So I would look and see if you have any other symptoms of Bartonella. So other symptoms of Bartonella are pain on the soles of the feet. Sometimes having a lot of anxiety and depression could be part of that. Tremors or shakes, an internal feeling of vibrating or buzzing. Sometimes people with Bartonella have air hunger. And sometimes people with Bartonella get a lot of excessive daytime sweating. Also, sometimes people with Bartonella will get a rash that looks like scratch or stretch marks, okay? So if you have a number of those things, or a severe cognitive impairment, if you have a number of those things, then probably your buzzing and vibrating is part of Bartonella, okay? In terms of meningitis means inflammation of the meninges or the covering of the brain that usually shows up with a lot of bad neck pain, but not just pain, stiffness, because every time you bend the neck, that puts pressure on these inflamed meninges and it makes the pain worse. So you get stiffness so that you're not bending and putting pressure on the inflamed meninges, basically, all right? And encephalitis, usually it's going to have, people are going to have temperature and they're going to have just marked confusion, like more like acute kind of confusion, okay? All right. Good luck to you, TJ. Hello, Lynn. Let's see. Hi, Dr. Ross. Is there any test to confirm mold? It sounds like if I get a high gliotoxin level on a real-time labs test, it could be from yeast. I don't score high on the yeast questionnaire, so does that mean I should treat for mold? All right, so real-time labs reports 5 groups of toxins. They are ochratoxin, aflatoxin, trichosethine, which is the group of black mold toxins, gliotoxin, and something called xerolino. Okay, that's what real-time reports, all right? All of those toxins, all those 5 groups, come from wet buildings and mold in wet buildings. In addition, yeast, intestinal yeast, candida intestinal yeast, can sometimes produce gliotoxin. If I have somebody that has high gliotoxin levels, I will then ask them all the questions I talked about earlier tonight to see if you have too many intestinal yeast, all right? And if they have a lot of those questions suggesting intestinal yeast, I will kill the intestinal yeast first before I put them on, and also still put them on binders to pull it out, okay? But that's there isn't really a test you can do that proves you have intestinal yeast giving your gliotoxin. It's just that if you have enough of those positive yeast questionnaire symptoms or yeast infection symptoms, then you also want to kill the yeast in addition to doing binders, okay? All right. So I'm going to do a screen share to show you the article I have on how you figure out if you have too many yeast. All right, so take a look at my Lyme guide and take a look at the yeast chapter right here. So in terms of figuring out if you have too many yeast, read through this article called A Silent Problem, Is It Yeast? Okay. All right, very good. Good luck to you, Lynn. Hello, Molly. Let's see. How long should you be on the max dose with disulfiram? Yeah, this is really weird. I've used tons of disulfiram in my practice. I haven't been lately, though. I'm having other ways that I'm approaching persisters, but I believe it's 2 months. I'm having a brain fart on that one. Let's go back and look together here. So I'm going to do a quick screen share here. So look up disulfiram. Let's see here. Hold on, I'm going to put my glasses on here. Oh, okay. It's actually, you want to be at your target dose for 4 months, not 2 months, for 4 months. And it takes about 4 months to work up to your target dose. And then once you're there, you want to try to be at it for a total of 4 months, okay? A year, 2 years ago, I was using a lot of disulfiram in my practice. The trouble is, I think that about 30% of people get good benefit from it. But the rest of the people really just have a nasty time with it and don't make a lot of headway for a majority of them. And I think that a majority of us that treat Lyme disease now are starting to step away from using disulfiram. I think we went through that phase, if you will. And, 30% of people getting well is good, but there's 70% of people that didn't. And there's some people that are left with permanent neuropathy. And so we just got to be careful with using that medication. There's other options I use to treat persisters these days. I like using methylene blue. I sometimes will use a dapsone regimen, the Horowitz dapsone regimen. And frankly, I'm used to using a lot of herbal supplements that have been shown through experiments at Johns Hopkins University to treat persisters, all right? And so those are things like cat's claw can treat persisters, cinnamon, clove, and oregano oils can treat persisters, Cryptolepis can treat persisters. Japanese knotweed can treat persisters. So, there's a variety of ways we can skin that cat now, basically. Okay. All right. Thanks for the question, Molly. Hello, Mary. I say, hi, Dr. Ross. Thank you so much for information about yeast. I'm hoping that is a turning point for me. I was only able to get diflucan 100 milligrams for 30 days. I also eat 1 garlic clove a day. Do you think this will be sufficient enough, or should I try harder to add nystatin? Mary, it may be enough. I can't say for sure. First, I don't know your size. I don't know how big you are. In terms of weight, I don't know that. And so, my favorite way, my frontline combination is to use diflucan in an adult at 200 milligrams, not 100 milligrams. And I like to combine it with nystatin. I combine it with nystatin because we tend to see that yeast do have an ability to learn resistance to diflucan. Nystatin tends to prevent that. And I find better outcomes using it too. But if I've got somebody that can't tolerate taking nystatin, because there's an occasional person that will have nausea, maybe diarrhea on it, we'll stop it, and then I got to still put them on something else to take with the diflucan. Garlic is an option. I like using garlic as a crushed clove, and the reason you want to crush it is crushing garlic activates a chemical in it called allicin. And the act of crushing or pressing garlic is what activates that, okay? So people crush a clove of garlic, chop it up, throw it across their salad. Right? Or you can actually crush it, put it in a glass of water, and just drink it down. I know that sounds very palatable, but you can do it that way. And I get some good results with that, okay? So yeah, that seems like a reasonable thing to combine with your diflucan. I think ideally it'd be great if you could get 200 milligrams, but if you can't, try the 100 milligrams with the garlic and see where you get, okay? All right. Good luck to you, Mary. Hello, Thomas. Let's see. How does Rocephin do? I had a neighbor that got it for a kidney infection there, and their Lyme had significant improvement. So Rocephin is also known as ceftriaxone. That's the generic name, and it is given in an injectable form. All right. So if your neighbor got it for a bad kidney infection, they thought it was bad, they gave them IV because usually urinary tract infections we can use oral medications, but often even the kidneys will respond to oral medications too, but sometimes they don't. So you got to use IV. All right. In terms of Lyme, Rocephin is useful at treating the spirochete form of Lyme, but probably doesn't do anything for intracellular Lyme and probably doesn't do anything for the microscopic cyst Lyme. All right, because remember, Lyme actually has 3 different appearances or looks. There's the corkscrew, okay, that's called the spirochete. There's Lyme that moves inside of cells, and when it moves inside of cells, it loses its covering. That's called the L form. And then there's microscopic cyst forms of Lyme. And these all can morph back and forth, okay? And so you need to treat all the forms at the same time. And the ceftriaxone is good at treating spirochete, maybe picks up cyst, but isn't going to do anything for intracellular Lyme. Also, because it's IV, it's going to do a good job of crossing over what we call the blood-brain barrier, so getting into the brain. So, yeah, I mean, it can give help, but it's not going to treat enough of what Lyme is in you, okay? All right. Good luck, Thomas. Hello, Wendy. Let's see here. Thanks, Dr. Marty, for another great webinar. You're welcome. My integrated physician tested my TGF-beta 1 results were 6,411, which is high. She then had me do the Great Plains Mycotoxin urine test. Results are ochratoxin A at 8.51 and citrulline at 42.86. I have not had a follow-up appointment yet. My own research on using cholestyramine to bind mycotoxin states it can damage mitochondria, and I need it to support my immune function. Is this true? Should I use cholestyramine in your opinion? So, for this kind of a picture of elevated ochratoxin and citrulline, cholestyramine could work. I'm not sure what they're saying about damaged mitochondria. I haven't seen something like that happen before. And cholestyramine is not going to hurt your immune functions. I'm not sure who you're reading or what you're reading. I just haven't seen that happen. The alternative to a cholestyramine would be to use a broad spectrum binder, herbal product that has many different things in it. And to do that, you could use like a Mycopole by Research Nutritionals, or you could use a GI detox by Biobotanical Research. And I usually would have my patients start at 1 a day. And then after a week or so, if they're not flared up, go to 2 pills 1 time a day. That's an option as well, too. Okay? All right. Good luck to you, Wendy. Hello, Sandy. Let's see. When you treat Babesia with tafenoquine, Crintofol, do you pulse it on for a while, then off, then on again? How do you pulse it? How many months total do you keep your Babesia patients on tafenoquine? Thank you. All right. So I'm having my patients take their tafenoquine every 2 weeks, and I have them take 2 pills. Okay. It is possible. There are some practitioners out there I know that are having people take them weekly. The truth is, we have no studies that show what is the effective dosing for getting rid of Babesia. All right. There are some case reports that shows tafenoquine has been helpful in treating Babesia microti. That's good. So we got some evidence based on somebody treating a patient with Babesia microti. But no one has done studies to say what's the ideal dosing frequency or the ideal dose for Babesia of any kind in Lyme disease, okay? So, but I am finding good success using it as 2 pills every 2 weeks, basically. And I am treating for a total time from when we start doing every 2-week treatments until the end. That time period's about 4 to 5 months is what I'm doing it, okay? All right. So tafenoquine, everyone, is in a family called the quinolines, of which primaquine is another one. The tafenoquine is getting increasingly hard to find. And because of that, I'm kind of going back to using a lot more primaquine again. Okay. All right. If you're wondering what these foreign words mean and what to do with them, let me just show you a quick screen share where you can take a look at the article I've written on these. All right. So let's see. We're going to look at the infection treatment plans. Take a look at this article called Kills Babesia, a Brief Guide. And in here, I describe different tiers of treatment. And my best tier, tier 1, you can either do atovaquone treatments or base treatments, or you can do quinoline-based treatments. And then the quinolines are primaquine or tafenoquine, okay? Good luck to you, Sandy. Hello, Heidi. Let's see. Hello, Dr. Ross. Can you share criterion that I can consider to decide whether to do antibiotic therapy or an herbal protocol for long Lyme? I have POTS, and it appears to be related to the Lyme. I'm not excited about destroying my gut, but want to make the most effective choice. Okay. So, in my practice, I use herbal antibiotics and prescription antibiotics interchangeably. And what I try to do with my patients is to discuss with them the odds of getting better that I see in my practice to help them make their choice. Okay. So My go-to herbal antibiotics for treating the Lyme infection are cat's claw, otoba bark, and then also to couple that for the persister side of things with liposomal cinnamon, clove, and oregano. Okay. I see that those work in combination well to help somebody with Lyme about 90% of the time. They have a 90% chance of helping somebody. Okay. By comparison, if I use a prescription antibiotic regimen that deals with both spirochete and cyst Lyme and put somebody on cinnamon, clove, oregano for the persisters, which I will use with those prescription antibiotics, again, I see that it helps people 90% of the time. All right. So when it comes to the Lyme germ, I give people an equal chance of herbal antibiotics helping them compared to prescription antibiotics at the beginning of their chronic Lyme treatment. All right. You can go either way. All right. But when it comes to Bartonella, I give a prescription combination treatment about an 80 to 85% chance of working, while I give the herbal antibiotic regimens about a chance of about 70 to 75%. Okay. So for Bartonella, there's about a 10% different chance. For Babesia, I give the prescription-based anti-Babesial medicines about an 80 to 85% chance of working, and I give the prescriptions, the prescriptions I give an 80 to 85%, and the herbals I give an 75 to 80% chance. Okay, so there's about a 5% difference there, all right? So I provide that information to patients, and I say, look, in terms of it getting you well, this is the difference between prescription and herbal, all right? And you should also be aware that whenever we use prescription antibiotics, we have a greater chance of disrupting the healthy gut microbiome compared to herbal antibiotics. But herbal antibiotics are not a free ride either. They may still do some disturbance. It's just that their ability to do a major disturbance is less than the prescriptions, all right? So I engage my patients in a discussion. I say, which one resonates better with you? Which way would you like to go? Well, how do you want to start this? Okay. So those are just some things that I work through with my patients. Okay. All right. Good luck to you. Hello, Matthias. Let's see. I'm once again confused where I have to post the questions to repeat. Sorry. Oh, Matthias, I see what you're saying. We answered that earlier. So what I'm trying to do, you have two options of where you can post questions in this format to me, everyone. You can either use something that has a chat sign at the bottom. So if you go down to the bottom where you can write things, you're going to see in that area right above, there's something that looks like two chat boxes over on top of each other, or there's a question mark. I prefer these days you actually write in that chat where there's two chat boxes over. You just click that and then write, or you can do it in the question mark one too. I have no problem with that. Okay. Let's see. Hello, Penny. Let's see. Hello. I'm looking for advice for my daughter. She has had a year and a half in remission for chronic Lyme. She injured herself and spiraled out of control stressing. She is convinced it's rheumatoid arthritis and a lot of pain. Lyme doctor says it's the stress in the body imitating Lyme. I need your advice. Boy, I don't know. I mean, I wish I could answer it with a simple question, a simple answer, but I would need to talk to your daughter and ask her lots of questions and get more information because I don't have enough information here to make that decision. Okay. All right. Good luck. Good luck to your daughter and good luck to you. Thanks. Hello, Penny again. Let's see. How do you test for mold toxicity? So in the world of Lyme disease, the majority of us will test for mold toxicity by doing a urine test to see if you are peeing out too many mold toxins. It's a way of measuring, do you really have mold toxicity or mold toxins in you? Okay. Because the only way you're going to pee them out is if you've got too many sitting in your bloodstream, basically. Now, getting mold toxins out through urine is not the most useful way of getting rid of them, but we still pee them out in our urine, and giving us a way to look inside and see if they're in you. Okay. The company I like using to do my urine mycotoxin testing is Real-Time Labs. There's also Great Plains Labs. There's also Vibrant Health. Vibrant is the new kid on the block, and it's not clear to me whether their testing is valid. I'll be honest with you, okay? I have more experience these days working with Real-Time Labs, and I find them to be more reliable in terms of what's there than I do Great Plains, although Great Plains is a reasonable solution that tends to be a little bit less expensive than the Real-Time's option, okay? All right. In terms of the big difference between Great Plains and Real-Time, Real-Time is better at picking up black mold. I just find more tests coming positive there when it was negative on the Great Plains. Okay, so Real-Time does a better job. Right now, keep in mind there's a whole other group of doctors out there that were trained by a physician named Richie Shoemaker. And Dr. Shoemaker does not believe in actually seeing if you have mold toxins in you by measuring them. What he likes to do is to have people draw a bunch of blood tests and look at the blood to see if there are certain elevations of certain inflammation chemicals. And if there are enough elevations of those chemicals, then he calls that mold toxicity syndrome, okay? So it's a little bit different. And the thing is about Shoemaker measuring all these chemicals is these inflammatory markers he's measuring also can be elevated if you have active Lyme. But Shoemaker doesn't believe in active chronic Lyme. So he doesn't understand that it is active Lyme in some patients that give you all these inflammation elevations, okay? Yeah. So the cleanest way to test is to really make sure it's in you, and that is to do the urine test. And I like using the Real-Time Labs to do that, okay? All right. Good luck to you. Hello, Gail. Hello, Dr. Ross. I've been following you for years, and I'm grateful for how you share your expertise and the good wishes. I wonder something biocidin. I wonder if biocidin is contraindicated for those of us with allergy to mold. I also have the genetic profile and history of chronic inflammatory response syndrome. I have a history of Lyme and think it's now reactivated. It's very difficult to find Lyme doctors in my state, so I need to do what I can on my own. Thanks for any thoughts you have. I don't think you have. I use biocidin in patients with mold allergies and have not had trouble with that. I'm going to go look at the ingredients together with you at the same time here. So I'm going to do a screen share. I'm going to do a screen share here. All right, so this is my supplement store, okay? And we're going to look at, and anyone can buy from here. This is for my patients, but it's also for anyone. If you read about something I'm on my websites or in these webinars and you're thinking you might want to try it, you can buy it from here, okay? Keep in mind, I don't charge taxes and free shipping too, okay? So take a look in terms of the biocide. Oops. So this is the biocidin LSF, okay, one of their formulations. And this is the new bottle that they've come up with. It's the same identical product as the dark blue bottle. They just rebranded their label, okay, all right, but no changes in the underlying formula, okay. So the underlying formula has in it, so let's see, it's got bilberry, grapeseed, shiitake mushroom extract, golden seal, noni, garlic, white willow bark, milk thistle, raspberry, echinacea, black walnut hull, black walnut leaf, lavender. You know, So I don't see anything in here that would lead to or reactivate a mold allergy or trigger a mold allergy. I think you'd be fine doing this. Okay. All right. Good luck to you, Gail. Hello, Penny again. Let's see. Is it okay to take Cytoquil 90 capsules on top of additional holistic medicine I'm currently on? Thank you so much. Probably, but I don't know the other things you're on. So I would need to look and see what those are, but probably you're fine. But I can't say for sure without knowing what else you're on. Okay. All right. Good luck to you, Penny. All right. Hello, Julia. Let's see. Hi, Dr. Ross. I have Lyme, Babesia, and Bartonella, and I'm currently on Malarone and doxycycline and clarithromycin. I have struggled with what I'm told is chronic alopecia. I have no history or autoimmune diseases. What tick-borne illnesses lead to chronic alopecia? So alopecia, everyone, means hair loss. So of these three, Babesia sometimes could be associated with hair loss. If it gets active, we'll tend to see hair loss get worse, okay? All right. So that's a possibility for you, okay? All right. Good luck to you, Julia. Hello, Carter. Let's see. Do you ever recommend antigraphis? I noticed you didn't have it in your protocol, but it was heavy in Buhner books. Is there a reason it's not a primary? Thank you. So Buhner, as many of you know, is a master herbalist and has written extensively and researched extensively about how to treat tick-borne infections. He recommends antigraphis, and the reason he recommends it is that it has good data showing it can help in a spirochete disorder called leptospirosis. And therefore, he assumes, without science, assumes that because Lyme is a spirochete, it will kill Lyme too, okay? But the truth is that research doesn't exist. And even though Buhner claims to be based all on research, he sometimes stretches things a little bit. I have not found good results with antigraphis in my practice. More recently, Johns Hopkins University, in doing some of its studies that it published over this last year, was looking at what should be used to treat growing and persister Lyme, and even growing and persister Bartonella. And when it looked at antigraphis, it did not find it effective at all. So this is a study looking specifically at antigraphis treating Lyme, and it wasn't useful. Okay. So again, I know that what Buhner's reasoning is, he thinks is because if it's useful against leptospirosis, which is a spirochete, therefore it must be effective against Lyme. I don't think that holds. Okay. All right. So that's why. All right. Good luck to you, Carter. Hello, Heidi. Let's see. Can you share criterion that I consider to say, well, oh, we did that earlier. Hello, Lou. Let's see. Arthritis in one leg worse, knee and hip, bad varicose veins and fluid retention, bad leg cramps at night for months. brought compression stockings and wearing them for evening hours, no cramps. Why did the cramps start? Why do the stockings help? So if you get fluid being retained in your legs, what that means is that the way that we get liquid out of our legs is it's either absorbed into our veins or it's absorbed into the lymph system. If they're not working well enough at absorbing the liquid and bringing them out of the legs, up to the body, up to the heart, then what's going to happen is you develop a lot of pressure in the legs from all this fluid being retained there, and that can hurt, basically. The compression stockings, with their pressure, squeezes this liquid out, so there's not as much pressure in your legs from the liquid, which then makes it so you don't have the pain, basically. Okay? All right. Good luck to you, Lou. Hello, Christine. Let's see. I have Lyme and Bartonella. There are times when I feel I have brain fog, and when that happens, I feel drunk, blurry eyes, and for all intents and purposes, I feel drunk to the point that I'm not sure it would be wise to drive. This includes feeling off balance. I don't drink alcohol or do drugs. What's happening? Thank you for you. You're welcome. Let's see. So, Christine, one thing I would want to do with you to help look at this is to evaluate part of your brain during a physical exam called the cerebellum. Cerebellum is a part of the brain that sits right back here. And if one of the symptoms you can get when it's involved is spinning feeling and imbalance, okay? And so there's some things we can do on an exam that help us understand what's going back here. One of those is closing your eyes and doing a finger to nose. All right. And if you have trouble doing that, then it may be a problem with the cerebellum. Another thing we can do is have people do hand slapping. So you kind of hold one hand up and you take one hand and go like this as fast as you can. All right. Same with the other hand. And again, if you have cerebellar problems, you may have a really clumsy time doing this. Okay, all right. And then the last thing we do is on the lower legs, you take one, you put your heel. So let's look at, I'll call this my foot, and this is my shin. I take my other leg and I try to drag it up and down the shin. And if you have a cerebellar problem, you'll have a lot of waving as you go about doing that. Okay, all right. So I would want to make sure that it's not a cerebellar problem, which I typically don't see Lyme involving the cerebellum. Keep in mind, we always have to be concerned when you have somebody with Lyme that you're careful not to call everything due to Lyme. We have to look for other causes too. Okay, all right. So that's how I would approach that. All right. Good luck to you. Hello, Sandy. I have Bartonella Babesia. Do you usually treat one and then the other, or both at the same time if you have symptoms of both? How many months on antibiotics and atopic? All right. So for Bartonella Babesia, I tend to try to get Bartonella cleared before I go for Babesia, or at least starting to be under some control. The reason is there's an observation I have had, and also an observation that Burrascano is a physician that is like the Lyme treatment pioneer in the country, or one of the pioneers. And it was his observation, if he tried getting rid of Babesia before Bartonella, that Bartonella became harder to treat. Okay, and I have to admit, I see something similar to that too. Okay, all right. Good luck to you, Sandy. Hello, Christine. I don't know if my last question was understood. I meant to say not that I have pain, but that I feel drunk to the point that I'm not sure if I can. Oh, okay. Anyhow. Yep, I got it. Thank you. Hello, Beth. Let's see. Dear Dr. Ross, thank you for everything you do. We have shared your website with many folks who are struggling with Lyme and other chronic fatigue-like illnesses. Your suggestion, thank you for sharing that. I appreciate that. Your suggestion back in May that we treat my son for yeast and yeast versus, I think you mean a Lyme relapse with GI symptom was right on. About 1 month into yeast treatment, he was free of all those GI symptoms and has remained free of them with continued Capri Plus and nystatin. Capri Plus, everyone, is an herbal combination product by a company called Karuna that has caprylic acid in it, some oregano, and also some garlic in it as well too. Oregano or thyme, either oregano or thyme oil. Let's see. Question number 1. If you are using lumber kinase along with cat's claw and otobobark to treat Lyme, do you still need to do the cinnamon clove oregano oil? So the answer to that is yes, you should. And the reason is there is some overlap in what lumber kinase versus these oils do, but not a complete overlap, okay? So the reason that I use cinnamon, oregano, clove oil is because it's been shown to treat persister forms of Lyme and also persister forms of Bartonella. It can also treat growing forms of those too. In addition, these volatile oils, the cinnamon, clove, oregano oils, can remove biofilm. The lumber kinase, on the other hand, is going to be useful at breaking up biofilm, but it doesn't do anything for persisters. Okay, so I would use it for the persisters. I think I went through this earlier tonight, but or I'll explain it again. Maybe I didn't do it tonight. But so in terms of terminology, and so for the Lyme germ, there are 3 ways that the Lyme germ looks. Okay, there's a spirochete, which is corkscrew. Lyme lives in cytocells, that's called intracellular, and then there's microscopic cyst form. Okay. We know from laboratory experiments that the spirochete and the cyst have a growing state and can go into hibernation, and we call those persisters, okay? Maybe 10% of the germs do that based on some lab evidence, all right? We don't know whether the intracellular Lyme goes into hibernation or not. There's no research that's been done looking at that. Part of the problem is, how do you look inside of a cell and see that, okay? Maybe they do, maybe they don't, okay? So we need to make sure that that idea of looking at persisters and treating for persisters is a newer concept in the last 5 years. We wonder if it is the main thing that holds people back from getting completely well, or is the thing that leads them to relapse after we stop treating, okay? So many of us for the last 3, maybe 5 years have been trying to add things into our treatments that have some laboratory evidence that they will treat the persister side of things as well too, okay? Let's see, question 2, is the herbal treatment for Borrelia miyamotoi different from for Borrelia burgdorferi? Can you still use the cat's claw, otobobark, cinnamon, oregano, clove regimen, or should you use something different or additional? Also, are the symptoms of miyamotoi different or distinct from burgdorferi? So, miyamotoi can give something called relapsing fever. A person will have cycles like every week of a temperature going up and then down, okay? That's one way that miyamotoi will present. On the other hand, it may present with symptoms that just look exactly like Lyme, okay? And so what I do for it, if I'm going to use herbal, I will do the cinnamon, clove, oregano. In addition, or the liposomal cinnamon, clove, oregano. In addition, I'll do a toba, and I will do the cat's claw as well too. Okay? All right. Good luck, Beth. Hello, Dave. Let's see. If you are the lucky individual with genetically get mold toxicity, can you pass this genetic defect to your child? Um, yeah, you could. But keep in mind, half of your child's genetics are from your partner too, or your child's biologic mom. Okay, so it even though you may pass some of the genetic profile, it may be less dominant than the profile passed by the mother. So, um, yeah, okay, all right. Good luck to you. Hello, S again. Let's see about microalbuminuria. He's already been on losartan for years. His blood sugar is normal. Also, is it normal to have a persistent cough post-COVID? For an 80-year-old male, are shingles and tetanus vaccines necessary? What are the risks and benefits? What about colonoscopies at that age? I have not. So my background is a family physician by training. So I used to do primary care. I used to do preventive medicine in my practice, but it's been years since I practiced that as my predominant form. I don't know what the data is saying anymore about whether you do colonoscopies on an 80-year-old. I honestly don't know. I don't know whether it's beneficial to do it or not, so I can't respond to that. I would have to look it up. And the shingles vaccine, I would probably think that is necessary. Keep in mind what happens with shingles. Shingles is basically reactivated chickenpox. And every year after, I think about age 50, if I'm right, as we age, the ability of our immune system to keep previous chickenpox that's still in us under control goes down, it diminishes. And especially by the time we get into the 80s, it's really diminished. And so for each year, as you go on, you get increased chances of getting shingles. And the trouble with shingles and an elderly person is we can get into chronic pain syndromes that may not get better even after the shingles is gone. So I usually I would look at that one as something to be probably a good idea. And tetanus, if he's an 80-year-old that's not out playing in the soil, that's going to get stuck with a rusty nail that has tetanus on it, he may not need it, but that's something he should be talking with his doctor about. I'm not his doctor. I don't know all of his health problems. Okay. All right. Good luck. Hello, Danielle. Let's see. My husband is starting his first course of antibiotics, Clacy and Augmentin, for Rickettsia cannori. Is this a good combination, and how can this affect the liver? Should a liver protectant be used at the same time? He also suffers from dysphagia. Can this get worse with diaphragm action, as this has been diagnosed as a symptom of tick diseases? Clacy. Hold on, I don't understand the first one you put here. I'm going to look it up real quick. I'm not sure what Clacy is. It's not showing up in my drug directory here. It's something I haven't seen. I'm wondering if you misspelled something, but I'm just not sure how to comment. Yeah, I can't comment because I'm not sure what that drug is. Okay. So in terms of could dysphagia be part of rickettsia? Yeah, it could be. Okay. Good luck to you. Hello, Wendy. Let's see. Do you need a physician to order Igenix Lyme test? My integrated physician uses a different testing company. I think you still do. The only way you'd have to find out by just giving Igenics a call. But I think go online, look up their telephone number, either email them or call them. They're responsive. But I think at this point they still are requiring physician's orders on those. Okay. All right. Good luck to you, Winnie. Hello, Frank. Let's see. While being treated for BART, is there any risk associated with vigorous exercising? Can this cause a herx or some other worsening of symptoms? So, Frank, for any tick-borne or tick-borne related infection like BART, Babesia, Lyme disease, which is Borrelia, there is always a risk that too much exercise will flare a person. But everybody's threshold is different. So what I usually tell my patients to do is if they are being active, and I do encourage activity, and the reason I encourage activity is it helps the immune system work better, it helps you get better night's sleep, etc. Okay. But I encourage my patients, if they are going to exercise, to try by trial and error to find a level they can tolerate. So I advise them to exercise to tolerance. Okay. So what that could look like is going out and doing a 15-minute run instead of your 1-hour run as your first time and seeing how do you tolerate it. If you get a lot worse the next day, probably not a good idea to keep doing that level. And then you might want to cut that in half and try it again. By trial and error, you find out what is the level you can tolerate. If you repeatedly exercise in a way that flares you up, that is not good for your health and may suppress the immune system as well too. Okay? All right. Good luck to you, Frank. Hello, Danielle. See, each time my husband has had something to eat, he gets hiccups thereafter, which only started after the tick-borne diagnosis together with dysphagia. Is this a normal symptom? So it's not a normal symptom, but it can be part of neurologic dysfunction and neurologic agitation of the diaphragm created by the illness, okay? But I wouldn't call it a common symptom, okay? All right. Hello, Danielle again. Let's see. Can curcumin be taken at the same time as lamoxicam to help with the diaphragm action during antibiotic treatment and a liver protectant? The answer is yes, it can. It's got a totally different mechanism of action. It's better for cytokine inflammation than what lamoxicam is, which is more prostaglandin-related inflammation, not cytokine-related. Okay? Good luck to you. Oh, so cytokine inflammation is what comes about from infections. Its immune system reacts by making too many inflammatory chemicals called cytokines. That's where your inflammation comes from. So it's inflammation triggered by infection, basically. Okay. Let's see here. Hello, Christine. I was diagnosed with Bartonella and Lyme and began treatment in May of 2022. I'm now beginning my 3rd month in treatment. My doctor is prescribing 805 milligrams times 4 twice a day, along with Bactrim, doxycycline, and clarithromycin all twice a day. I think your doctor is prescribing that 875 milligrams is Augmentin, I bet, which is amoxicillin, clavulanic acid, knowing the 875 milligram dose, times 4 twice per day, along with Bactrim, doxy, and clarithromycin all twice per day. I began Baluki yesterday and Herx, but not today. What is the highest dose I could take of Baluki? My symptoms are mostly neurologic. Was treated for 7 months by a neurologist for severe stabbing, persistent. Let's see. Headaches and neck pain. Finally, the neurologist wanted me tested for infection, especially Bartonella origenics. Positive both fish and PCR for Bartonella. How long before I change antibiotics? Getting better slowly. Had symptoms of encephalitis or edema at end of the neurology treatment. So when I'm treating for Bartonella, generally I'm going to, as long as somebody's getting improvements on the antibiotics I have them on, I'm going to leave them on it for about 4 to 6 months. I may add more antibiotics to what they're taking, but to answer your question, 4 to 6 months, okay. And then in terms of the first part of your question, in terms of how much Baluki can you take, Baluki is liver kinase, and it's a 20 milligram pill. I often will have people take 1 pill twice a day, but if I really want to push the dose and be super aggressive, I sometimes will go to 2 pills twice a day. Keep in mind when you use it, you may get a significant herx. What it can do in Bartonella specifically is it may break apart some biofilm, slime layers that cover the germs. But the bigger thing that it does is Bartonella likes to mix itself up with a blood-clotting protein called fibrin. And when you get Bartonella mixed with fibrin, it forms these Bartonella fibrin nest, okay? And these nests have the ability to stick themselves on your blood vessel walls, and they kind of hide away from the antibiotics then. And so using liver kinase is a way to break those down. It breaks up the blood-clotting protein, the fibrin, and the nest can then fall apart, and your antibiotics can get in. Your immune system can get in better and get at the germs, basically, okay? So when you use it, if you're doing it 1 twice a day, often that's going to trigger a herx. These days, I usually start at 1 a day. I try to work up to at least 1 twice a day. But on some people, I sometimes will go higher, up to 2 pills twice a day. Okay? All right. Good luck to you. Hello, Patricia. Hello, Dr. Ross. Thank you for having this session and for taking my question. Various herbs are recommended for Lyme and other co-infections. Is it okay to take herbs for several co-infections at once? Can you take too many herbs? Do any of them interact with each other? Thank you. So, I usually have my patients just take all their herbal antibiotics at the same time. Okay. That last question, can you take too many herbs? In theory, yes. Do any of them interact with each other? None of the ones that I'm generally recommending. So if you look at the ones I recommend for Lyme are Toba cat's claw, these days Cryptolepis, even Japanese knotweed, teasel sometimes. All of those, I see no interaction problems. I'll use them together, 2 or 3 of them maybe. Liposomal Simicova oregano in that too. The ones that I use for Bartonella would be Japanese knotweed, Psittacuta hutania, maybe Cryptolepis based on some of the newer Johns Hopkins research. And those that I just mentioned for Bartonella and those that I just mentioned for Lyme, I will use combinations of those, and I see no problem mixing them together. Okay, so I don't see there's a problem. All right. Hello, Heidi. Let's see. Have you heard of using Miravoric for Lyme, the Bruce Patterson protocol? No, I have not. Let me look that one up real quick. No. I haven't actually. I'm going to have to look into this one a little bit more. Anyhow, no, I haven't. All right. Thanks, Heidi, for that question. These webinars, I learn something sometimes too. People bring ideas into it that I am not aware of, and I look into them. Sometimes I incorporate them in my practices, sometimes I don't. But that's one I haven't heard of. Okay. All right. Hello, Ken. Let's see. Dr. Ross, can antibiotics like flagyl and Bioxin create issues with cortisol levels? Thank you. I haven't seen them. If anything, they may help improve your cortisol status as you get the germs knocked down and you get the cytokines lowered by knocking the germs down and you start having better adrenal function. All right. Thanks for the question, Ken. Hello, Sherry. Hello, Dr. Ross. Do you have your patients take probiotics while on herbal treatments, and when is the best time to take the probiotics? So I have my patients on any antimicrobial, any bacteria antimicrobial, whether it's herbal antibiotics or prescription antibiotics, I have them take probiotics. And although I know the greatest problem for interruption of the healthy gut microbiome comes from prescription antibiotics, I've seen people get intestinal yeast infections, vaginal yeast infections when they've been on herbal antibiotics. So I know that there's some disruption even from herbal antibiotics as well too. Okay, so to prevent that, I will have my patients take probiotics. The time of day that I usually have them take it is as far away from the herbal or prescription antibiotics as they can. So for instance, if they're 2 times a day herbal or prescription antibiotics in the morning and at night, somewhere in the middle of the day. If it's a 3 times a day regimen, I will find some space between one, like maybe the morning and the middle of the day one. Somewhere in the middle is when I'll have them take it. Okay? All right. Good luck to you, Sherry. And let's see. Penny says... She says, yes, you do on the IGeneX. And I think what Penny is responding to is the question earlier about, do you need a physician to sign it? So anyhow, I don't know that. I would have to call IGeneX myself to figure that out. But this is what Penny says. All right. All right, everyone. Believe it or not, we got through every question tonight. Yeah. And so that's good. I hope you join me again next week. I enjoyed being with you here tonight. I must admit I was a little bit sleepy because of my Basinjis having their issues last night, but I'm glad we were able to spend some time together here. And I do look forward to seeing you again next week. Tomorrow morning, look in your email somewhere around 9:30 in the morning. You'll get an email from me that will have links to, will tell you that the recording is ready. And also that will give you information to sign up for next week's webinar as well too. And again, I'd appreciate if you share this, send it to people so that they get a chance to sign up and get some information that may help them as well too. Okay. All right. Great to see everyone tonight. And I wish you all well. Good night.